Knock, knock.
Explain the procedure.
Who's going to be the patient's voice?
Come in, Katie.
Go for it.
Come in.
Hi there. My name is Grace. I'm going to be your nurse for today. Can I get your name and date of birth?
Yes, Mary Johnson. 2/10/1997.
Perfect. Close enough. Today we're going to be putting in a nasogastric tube. Do you know what that is?
I think so.
It looks like this. It's a little tube that's going to go up your nose, down your throat, into your stomach. And this helps us to be able to push medications or feeding in case that we need to push it emergently or you're having any trouble swallowing. Does that sound like something that you'd be okay with?
Yes.
Okay.
Pull curtain for privacy.
Pulling the curtain. I'm
I'm
going to wash my hands, put on gloves. What next?
Head of bed between 45 and 90 degrees.
Okay, for the nasogastric tube, we got to make sure you're sitting up because it's easier for the tube to go down. So you want to make sure the bed's between 45 and 90 degree angle, which it is.
Okay.
Check the nasal patency and select best nostril.
Okay, now I want to ask you, is there a certain nostril that you feel like you can breathe better through? Do you have any stuffiness?
Feels like my right.
Let's go ahead and check. I'm going to include this nostril. Can you breathe in and out? All right, now this one. Do they both feel about the same, or does one feel more patent?
Actually, the right one feels more patent.
This one?
Yes.
Okay, perfect.
All right. So you do next is put a barf bib over the patient.
Okay, next we're going to take this little bib right here. We're going to place it over you just in case there's any spills. I don't want it to get all over you in your nice gown, okay?
Thank you.
Provide water with straw and emesis basin.
Okay, we have an emesis basin here just in case you start to feel sick or you need to spit up into this tray so it doesn't get all over the bed.
Okay.
Now it's time for you to measure your
We also have this water, which I'm going to let you drink when we put the tube down, which when you swallow, it's going to help the tube go down a little bit easier, okay?
Oh, okay.
measure the mark of your nose.
Okay, I'm going to get my tape first. I'm going to get my tape ready. Put it here on the side of the bed. If you have scissors, you can do that instead of using your teeth. Right there. Okay, now I'm going to measure how far we need to insert this tube into you, okay? I'm going to start at your nose and go back to the ear and then go down to the xiphoid process, and that should give us a rough idea of how far we need to insert it to get into your stomach, okay?
Okay.
I'm going to mark it with this piece of tape so we know that we're in the right spot. Okay.
Next, you want to educate your patient or raise their hand if they need a break during the procedure.
This should not be painful. It might be a little uncomfortable, but if you feel any sharp pain, let us know by raising your hand. If you need a break, you need us to slow down, you need to catch your breath. Don't try to speak during the procedure, but if you want to just raise your hand up, we'll take a break, okay?
Okay.
Lubricate the tip of the tube and insert it through the nostril with the best airflow.
Okay, we have lube. I would put the lube in there, but for now we're going to use the mannequin lube because we can't put real lube in a mannequin. You put lube on the tip of it, okay?
With the patient head hyperextended, aim the tube down toward the ear. Twist the tube slightly as you advance it.
Okay, so I'm going to have you tilt your head back like this, and I'm going to insert it until I start feeling resistance, okay?
Okay.
Here we go. Okay, I'm starting to feel resistance.
When you meet resistance, have patient drop head forward and educate patient to begin to swallow and drink water.
I'm going to have her sit up. I'm going to hand her this. Please don't spill. I'm going to hand her that. You're going to start sipping and swallowing, and every time I push in, swallow some, okay?
Okay.
So sip, swallow.
Swallowing.
Sip, swallow.
Swallowing.
Sip, swallow.
Swallowing.
Sip, swallow.
Swallowing.
You doing okay? One more. There you go. We are at the mark. Put this down. Okay.
Tape the tube securely to the nose using split pants method.
Okay, so I'm going to tape it at this point, because if I just leave it like this and start doing everything else, it might get dislodged. So I'm going to get my tape, make my little pants, put it on the nose, then go around the nose like that. And there we go, it's secured to the nose.
Verbalize 3 methods of verification.
Okay, there are 3 ways to make sure that the tube is in the right spot. The first two ways are things that I can do. The first one is I can check with an air bolus, listening by injecting air into this and see if I can hear it inside your belly. The second way is by pulling back and seeing if I can get stomach acid out of here. And the third way is an x-ray, which is the gold standard. I can't do that. We'll have to send you down for that procedure.
Demonstrate how to perform air bolus 10 to 20 mLs of air.
Anybody got a stethoscope? Just hand it to me just for show. Thanks. So I'm going to check with an air bolus to make sure that we're in the belly, okay? I'm about to take 10 to 20 mLs of air. I'm going to put my stethoscope in. I won't put it in my ears so it's not nasty. I'm going to hook it up into here. I'm going to place my stethoscope right over about where your belly is. And I'm going to insert the air. Gurgle, gurgle, gurgle. I hear it. Sounds like it's in the right spot. I'm going to go ahead and check the stomach acid.
Using the irrigating syringe to pull back using gentle suction as you aspirate the stomach content.
Look, juicy stomach acid. I'm going to undo it. Make sure you clamp this shut, right, so it doesn't spill everywhere. I'm going to take this.
Test the pH and verbalize normal range less than 4.
I'm going to dump it out into here. You can, just kind of squirt it onto your strip, but you might splash yourself, which is kind of gross. I'd prefer to just squirt it into the basin, then dip your test strip in there and compare it to your test strip. Normal is below 4. We'll say it's 3. Looks like this is normal stomach acid. It's pH of 3. And throw that in the trash. And now pull the stomach acid back into the syringe, right? Because we have to give it back to the patient. We don't want to mess up her pH balance. Put that gastric content back into her.
Close this NG tube with stopper so it doesn't leak and drain.
Make sure you close it back up. Don't leave it open.
Measure the tube from the insertion point at the nearest to the end of the tube.
So now you're going to measure. You can't really because there's no numbers on here, but normally the NG tubes have numbers on them. These are just old. So you would measure from the point where it's in the nose to the end, right about where this blue marker is. Just in case, for whatever reason, the tape falls off the nose or the marker falls off, or if you put a permanent marker, if it gets rubbed off, that you can measure to make sure it's in the right spot. Because if the mark fell off of this and it's just in the bed, you don't know if it's come out some, and you need to know how much to reinsert it so it's in the right spot. So let's just say, it looks like it's 53 centimeters from the end of the nose to the bottom of this blue mark.
Okay. Educate the patient that this tube is not to be used until verified by X-ray.
Okay, so it looks like this is probably in the right spot since we heard the air bolus and that we got the gastric content. But just to make sure, we're going to send you down for x-ray to make sure that's in the right spot. So until that happens, we don't want anything to go down this tube. No medicines, no feedings, just until we make sure that's in the stomach and not going into your lungs, okay?
Sounds good.
And then
attach NG tube securely to the gown.
Now you can, some people tape to the cheek, but just for this, we're going to tape it to the gown. Just to keep it in place so it's not going to be yanking on the nose. Kind of like when we tape the Foley to the side of the leg, it's not pulling directly on the urethra. It just gives the nose some protection.
And then document the length, date, and time, pH, and how the patient tolerated the procedure.
So I'd make sure to chart that it's 9 o'clock, it's 11, whatever today is, 12, 2022, what the pH is, of her gastric content, and then the length from here to here that we document 53 centimeters, and how the patient tolerated it. She tolerated it well, but we might want to document in case she threw up during the procedure or gagged, or if she had any bleeding or whatever, just so people would know. And that's how you do an NG tube.